I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
So welcome to IDD Health Matters. Today, I have with me Maria Saladino. Maria, welcome.
Thank you.
Tell us a little bit about yourself and how you got started in the field of healthcare for people with intellectual and developmental disabilities.
Okay. I've been a registered nurse since 2001. When I initially went into nursing, I thought that midwife was going to be my path. And so I went directly into newborn nursery and mother-baby maternal nursing and found out after about 10 years that was not where I was supposed to be. I felt like there was something that needed my attention much more than mothers and babies. So I went to med-surg thinking maybe that was it. And in the meantime, I had suffered a back injury. And while I was off of work recouping from surgery, I had my application out there and I was contacted by a company that has residential homes for individuals with developmental disabilities. And I interviewed with the company. And from the moment I was in that very first interview, I knew that this is where I needed to be. So it's been about 9.5 years and I still feel like I made the right decision that day.
You know, that's a recurring theme we hear, and it's one of those things where in this field, you know very quickly if it's for you or if it's not for you. And if it's for you, it kind of grabs you and it hooks you in, and you're gonna be there.
Yes, I agree, 100%. And I find that even with training new nurses as they're coming into the field, that you can almost tell right away when somebody is going to be a phenomenal DD nurse. I mean, you can be a phenomenal nurse, but it's a different skill set when you're a DD nurse.
Yep, and there are all kinds of great ways to be a nurse or a physician or a direct support professional. There are different areas for that as well too. But there is kind of a certain calling, and like you said, you can kind of tell right away.
Yes.
And with that, though, comes a great reward when you find that niche that you would work in. So, you know, I would encourage people to think about this as an opportunity, and it may just be exactly what you're looking for.
Yeah.
Yeah.
And it might just even be something that you're looking for that you didn't even know, because I truly was not aware of this and I had already been a nurse for 15 plus years at that point. So I had no idea that this even existed, that nursing for that particular niche of people, and then also in the group home setting for sure, was very eye-opening and absolutely different than anything I had done previously.
Yeah, and I can say the same thing for me too as well. I was a family physician. I was doing regular family practice for about 4 years, and ways into that, I'm like, this is just not what I want to do for the rest of my life. Mm-hmm. And I kind of fell into this field accidentally, didn't really know it was out there. And one of the things I learned, and I'm curious what your experience is very quickly I learned how ill-prepared I was to work in this field. So did you have any experiences like that? Yes,
I did. And I thought maybe I had a little bit of knowledge coming into it, just because in the past working in acute care in the hospital setting, I did take care of people that had developmental disabilities, but it wasn't the main focus. And looking back, once I actually started in this field, I remembered that when I graduated from 8th grade, one of the things that we had to do when we graduated was to volunteer somewhere, and they gave us multiple places. And I actually ended up volunteering with the special South Suburban Special Recreation Association, which is one of the organizations in my community that does outings and special events for people with developmental disabilities. So even all that time back then, and I remember coming home and telling my mom how much I enjoyed just being out in public and being able to accompany them on these events. And it really did, it was profound to me even at that time. And maybe I didn't recognize it at the forefront, but after I started working here again, I remembered that and thought, maybe it was something that was kind of full circle.
Yeah. So you had that feeling of as a nurse. Do you see that kind of similar attachment in other professions in this field, like direct support professionals, that some of them come in and they're just like, okay, this is where I've got to work for forever, kind of a thing? I
do. And I'm always impressed when I hear that the longevity, sometime 25, 30 years. Yep. And it's impressive.
Yeah.
Impressive.
It really is. It really is. Mm-hmm. So, we're talking a lot about health equity and people with intellectual and developmental disabilities having access to the same level of health care, at least a basic level of competent health care when they go to healthcare providers of different types. Mm-hmm. Can you speak to that? What have you seen in that area in terms of people accessing healthcare, people with disabilities accessing healthcare, and positives, negatives, both in between? I'm
unfortunately, I have to say that there's probably more negative than positive. I do see improvements though, but I think it takes a lot. It takes a village. It takes a lot of advocating from us as the people that have the expertise to have the enough confidence to come to a physician or any medical professional and really advocate, because sometimes it's hard as a nurse to say to a physician, I don't agree, or I think that you need to look at it from a different perspective. But truly, because the education, the standard education is not available for people with developmental disabilities, we are the experts, the ones that are in the homes taking care of these individuals. We are the people with the expertise. So we have to be able to advocate to make that better.
Yeah, I get that as well. And I learned that the hard way, or I learned how to provide healthcare to people with IDD. I would call it the hard way or the long road. I learned it from nurses who had been working in the field for many years that I was so thankful for when I started working, as a medical director of an intermediate care facility. I was so glad they were there, because it was like, okay, I have the interest and I have the desire, but I don't have the understanding of some of the things that I'm seeing, and how one of the big things, how behaviors are often signs of some underlying medical condition.
Yes.
And so often we think about it as, it's just what a person with an intellectual disability does. And we blame it on the disability without ever looking for a treatable cause, and that person goes on suffering.
Yes.
And that term, I'm sure you're familiar with it, it's called diagnostic overshadowing, where we blame or not say blame, but we attribute a certain sign or symptom to the person's other diagnosis, like a disability, without looking for other causes. And what's interesting is, the Joint Commission put out a Sentinel event alert in June of 2022, warning about diagnostic overshadowing in people with mental health conditions and people with intellectual and developmental disabilities specifically. And that actually was exciting to me, because it means people outside of this field are starting to get it, and they're starting to recognize that we probably could do better with training and education. And that sounds like something you feel pretty strongly about as well, too. Especially
for the psychiatric portion of that. When I first came into this job, again, I didn't have a ton of experience in this field, and definitely did not have the experience with mental health. And I have a story that I'll share with you that was my aha moment once I actually understood what my role and what truly being an advocate for my individuals meant. I had a elderly, she was probably in her 60s at this point, who was living in one of our homes, and it was the summertime. It was a year where we had a ton of rain in the area that I lived. So we had a river nearby this home, and the river would flood a lot during this time. And so the trees were covered with moss, like a tree looks. And so this particular individual had been taken to the doctor and told the doctor that she saw alligators in a tree. So the doctor put her on an Exelon patch for this. And I agreed to it. I was part of that community support team, and not understanding my role, I had agreed, yes, let's try this medication. So the next time she went, they upped her dose. Third time, it was right around 4th of July, and I happened to just be at the house. I wasn't there for any particular reason. And she's sitting on the swing on the front porch. And so I sat next to her, and we're just chatting. And so she says to me, "Hey, honey, doesn't it look like there's an alligator in that tree?" And I said, "Carol, do alligators live in trees?" And she put her foot down on that glider and stopped swinging and turned at me. And she said, "I know alligators don't live in a tree, but doesn't it look like there's an alligator in that tree?" And it really chokes me up even to this day when I tell that, because it did 100%. That the bark was bumpy, it was green because of the mold and from the flooding of the streets. And I just took that moment to just listen to her say the word "it looks like" instead of "there is." And so I walked her to the tree and I said, "Show me what you mean." And she pointed out everything out anatomically, and it looked exactly like she said. So I snapped a picture of it and sent it to the neurologist and said, here's Carol's alligator. She realizes it's not real. She said it looks like it. And unfortunately, I was not able to get them to reverse her being on that medication. The doctor felt that his knowledge, or that the medication was what led her to believe that it was not real, that it was just something that she was seeing, which maybe, but I don't necessarily agree. So after that, there was never a time that a psychotropic medication was ordered for an individual that I just blindly signed my name to after that. I have questions. I want them answered because...
What a great illustration of the level of care and support and skills that are needed to work in this field that really do need to be developed. And it's important I think it's so important for nurses who work in this field to be recognized for that level of skill. And really, you should be paid more as well, too, along with direct support professionals and a lot of other people who work in this field. You know, let's face it, most of us who work in this field don't go into it to become rich.
Right.
But we become rich in other ways and things like that. And making those kinds of differences in people's lives really is valuable and important.
Very.
Yeah, absolutely. So you work at a provider organization, right? And so what are some things that you see there that you'd say are great practices that you'd like other people to know about in terms of, providing support or services, health related or not, things that you see that are good at your organization or really anywhere, things that you see promising?
Sure. Well, I think that some good things that we have done, switching over to a lot of webinar-based format trainings, thanks to COVID.
We kind of got pushed into that, but it kind of is nice in a lot of ways, right?
I think it makes you realize that we can get a bigger group of people together and do training and more of a large scale than we had been previously doing it. And it also really does make everything standardized, because previous to that, everybody kind of taught their own way. So now when you have standard people that are teaching, I think that helps to get
I'm
better.
Really big on standardized things, and people using the same forms and to document things in a similar way, because, it helps you to contextualize that and to make decisions based on that information a little bit better when you know that everybody's coming from the same place.
Yes.
So that's a really
absolutely
important thing.
And then the organization that I work for, they put the individuals first. If there's additional supplies that are needed or things that, maybe in other organizations would be beyond reach financially, they work really hard to make sure that the individuals have whatever it is that they need, be that from medical equipment all the way to, outings and events and things that, they want to plan. So they're very generous in that regard. And, they really do make sure that the individuals are well taken care of.
That's wonderful here. And sometimes that can be challenging, not for lack of heart, but for lack of funding.
Yes.
Yeah. Funding can certainly be a challenge and impact a lot of the things that we do. So it sounds like your organization has found some great ways to maximize the funds that they have and do it in a good way. So that's great.
Yeah.
That's great. And certainly, obviously, is an asset of them having you there.
Thank you.
For sure. Yeah.
Thank you very much.
So we need more people like you in this field, no doubt.
Appreciate that. Thank you.
Yeah. So what are, besides education, are there some other challenges that you see to that maybe have a little bit of a negative effect in what we can do or what we'd like to do in this field? Besides education, we know that's a big component, but
yeah, I think resources is another component that we really struggle with. And sometimes even those resources are the staff that we need that have good knowledge or the desire sometimes even to obtain that good knowledge, that really understand that this is not a position that you come into as a fleeting job. This is something that you need to do long term and, do with your heart, because you are working with people that depend on you. Our individuals consider the employees that come in and out, that's their family, and so you want to have a good family. We, unfortunately in real life, we can't pick our family, but we can pick the family that's coming into the home. So, sometimes the resources aren't there even for that. And then barriers with the ability to get specialty doctors is really something that is challenging, because we'll get a lot of referrals for a neurologist and they'll give us a list of 15 neurologists in the area, but oftentimes they're not accepting new patients or our insurance, or, just don't have the desire to accept new patients with developmental disability.
Yeah, and I have to say that does go back to education.
Mm-hmm.
And if clinicians were more comfortable with treating people with intellectual and developmental disabilities, they would certainly be more willing to accept them into their practices. There's been some studies that have recently shown that a large number of clinicians aren't willing to accept people and don't even feel confident that they can provide the same level of care to people with intellectual and developmental disabilities. And that, I have to say, falls to the training programs. I'm a big advocate for training our healthcare providers of all levels about IDD healthcare, and it's something that we really need to continue to work towards and push towards. So we do a little thing here called 3 and 3.
Okay.
So it's 3 things that you would want to tell listeners that they can get involved in, that they can do, that they can work towards, that they can put some energy into, that would have a positive impact on health, wellness, lives, the supports and services, whatever you want to frame it. So 3 things that you can point people towards, or to think about, or to work towards, and you have 3 minutes to do it.
Okay. All right. That's a lot of pressure. Okay. So the first thing...
Don't feel pressured. I'm not going to even keep time.
Oh, good. The first thing is to find some place to volunteer. I think that even just knowing that there are these organizations in your community, it would be a huge asset. So volunteer, go in there and find out if they're doing events. We can always use volunteers to even come into the homes and do programs with the individuals. So volunteering, finding those organizations, I think would be a great thing. Special Olympics is another huge one that is such a great organization to get involved with. And I think that from there, you can really make some connections and build some bonds with people that could be lifelong. That's 2, right? I could use that as 2. Okay.
That's 2.
All right. One more. Let's see.
Government related, local, state, national.
Yes. Getting in and right into your Congress people and making sure that they're aware as well of the struggles that we have in group homes, especially if you are touched by somebody in your lives that struggles and that has had developmental disabilities or an intellectual disability who you've noticed that has struggled with these things. It's great to be that advocate. So if you can write to the local business, or the politicians, and have that discussion, I think that's a big one too.
Well, those are 3 great things. And so these are calls to action for everybody out there. Go and volunteer. Go and spend time with people with intellectual and developmental disabilities. And you'll learn that they are people first.
Yes.
And they are people with likes and dislikes and wants and needs and desires, just like everybody else.
Absolutely.
They may express things differently, but it will add value to your life. I will say that. Absolutely. So, Maria, is there anything else you'd like to add today?
I would just say that truly, I don't think that you will ever be upset that you got involved in a organization that takes care of people with developmental disabilities. There's never a day that goes by that I'm not smiling from something that happened at work. Even if I've had the worst day, I honestly will stop at one of my homes on my way out of town just to see somebody that makes me smile, because it's genuine. They're happy to see you. They genuinely appreciate what is, given to them. Anything that we're doing with the individuals, they're always so appreciative of. So it's, real genuine connections that you make.
Well, Maria, thank you so much for sharing your stories. They're very heartwarming and touching, and I believe it will impact people that are watching out there.
Thank you.
So thanks for sharing.
You're welcome.